Good morning, everyone. I'm Dr. S.K. Singh, working as a principal in the School of Pharmacy. Today, I'll discuss about that pharmacy profession and our school also, SGVU. What is means main USP of the Gambier School of Pharmacy. I will share one screen, and you can see that. So, Gambier School of Pharmacy, it was established uh, in the year 2003, right? So you might be wanting that why the pharmacy, why you choose the pharmacy. Then what is the Indian pharmaceutical industry current status, higher education and scope after the B pharmacy, mission and vision of the SGV, university recognition, USP of the pharmacy, laboratory outcome and our products and alumni success story. So pharmacy, why pharmacy and if pharmacy, then why the pharmacy from SGV? Right? So student life after 10 plus 2, that what will the future, what about the college, which college you need to choose. So you have chosen a very renowned college. We are NRF ranking 64 out of 3,650 colleges which are available in the pharmacy department. And how okay, so you have already taken the admission, and I welcome you all. Okay. So we have mainly courses like D pharmacy, B pharmacy, and M pharmacy. Right? So D pharmacy eligibility 10 plus 2 PCM, PCB, and B pharmacy eligibility 10 plus 2 PCM or PCB. We have 100 seats in B pharmacy, and Master of Pharmacy eligibility is here 15 seats. Right? So, uh, pharmacy is the art and science of manufacturing and dispensing of drugs and biological products to prevent or cure the disease, uh, thereby preserving the health of humanity at the large. So, pharmacist is the drug information experts. So, pharmacist know more than a doctor. He knows about the medicines. Right? So every substance is poison, and we are the pharmacist. We make it as a medicine. Uh, so pharmacy is basically science of the medicines. So it manufacturing and distribution of the medicine for mankind, treatment and prevention of the disease. Okay. Right. So can you see my paper? Okay. So, till the end of the life on the earth, the pharmaceutical industry will goes down or set only with the molecules. So, जब तक चांद रहेगा, medicine का काम रहेगा. So, with the daily use, we use daily medicines like you might have used paracetamol for the your fever and antiviral drugs, antibiotics, right? So these are the simple medicines which we use in the day-to-day practice. So why pharmacy? So Indian pharmaceutical market is third largest in the world in the terms of volume. Indian pharmaceutical market is 10th largest in the terms of value. Right? So you can understand the importance of your pharmaceutical industry. So it accounts 10% of the volume terms of the global pharma industry. Okay, so it accounts for 1.5% in value terms of global pharma industry. So it supplies 62% of the global demand for the vaccines. So you know that during the your corona period, so maximum like your medicines, which are means India supply maximum medicine to the your Western countries and West African countries, right? So India is the source of a 60,000 generic brands across 60 therapeutical category, right? And manufacture more than 500 different APIs. APIs is nothing but your active pharmaceutical ingredient. Right? So after understanding the future effect of the pandemic situation of the COVID-19, India is aiming to increase its pharmaceutical industry revenue to around $120 billion to $130 billion by 2030 from the current revenue of $38 billion at the compound annual growth rate of 11 to 12%. The Indian government is proposing an incentive package of 16.76 billion Indian rupees, approximately $181 million, for the promotion of the domestic manufacturing of the critical key starting material, drug intermediates, APIs, and medical devices. The Indian pharmaceutical industry maintains great advantage, including the availability of a large labor pool and advanced technologies that enables high regulatory standard of market like US and European countries to the material. The many your industries situated in China are planning for shifting to India after COVID-19 impact. So impact of the current pandemic on the pharmaceutical industry. So COVID is your second wave pushes India's pharma industry growth to 59%. So you can see there is a tremendous growth in the pharmaceutical industry manufacturing. Then these are the pharmacy profession in the Indian COVID-19 pandemic, the present status, future and challenges of a way forward. This is impact of the current pandemic on the institution. This is an article. So healthcare goes mobile, then evaluation of teleconsultation and e-pharmacy. You know that e-pharmacy after the COVID period, it is grown like a tremendously. There is a growth in the e-pharmacy. So you can directly contact the doctors from the foreign origin also. Right? So higher education after B pharmacy. What you can do after B pharmacy? So M Pharma, you can take admission in M Pharma by GPAT examination in the various branches of pharmacy. Then MS is offered by the several universities as NIPER, BITS, Pilani in the various branches of applied pharmacy, like your forensic, clinical, your studies, pharmacology, then you can do the MBA through the CAT in the various subject, along with the specific courses like pharmaceutical management, hospital management, pharma marketing. Then you can do PG diploma in various courses like your clinical study, bioinformatics, and all. Then PhD and postdoc based on your research interest, you can go for the PhD. Right? Then opportunity abroad, MS through the GRE, US TOEFL, USA, UK, IELTS, right? Canada, UK, New Zealand. Then MBA in Pharma, you can go for GMAT, TOEFL, USA, UK, IELTS test. Then Canada, UK, and your New Zealand. Then PhD and postdoc, research work in the various universities and organizations based on your research work in the masters. Then the scope of pharmacy, what you can do after the pharmacy. Then you go for the pharmacist. As you know that in the Rajasthan, your free medicine is going on. Free medical medicine we are supplying to the hospitals, and it is mainly distributed by the pharmacists. So still there is 500 around vacancies in the government sector. Then you can go for the practice setting in the community pharmacy. You can go in the hospital. You can work in the clinical. Then other settings like you can go the academics, like you can go in the teaching and research. Then clinical research, you can go for the regulatory affairs. Then you can join the industry. So industries, various departments are there like your production, quality assurance, R&D, like bulk drug formulation, quality control, packaging, regulations, okay, so sales and marketing. So you can see that wide scope of pharmacy. Then I am a pharmacist, I am a specialist in the medication, I am companion of the physician, I am a counselor to the patient, I am a guardian of the public health. So this is my calling, this is my pride. So why SGVU? So you can see the why you have chosen SGVU. So we have a vision, specific vision to create a university with a different perspective, innovation, research-driven academic programs, engaging and retaining outstanding faculty, providing world-class yet affordable education in the various areas of study, thus to develop the highly qualified and global competitive professional experts. Sorry, capable of understanding the challenges of the rapidly changing world and sorry, contribute to the evolution of the society based on the human values and peaceful coexistence. Then we have a mission like the mission of Suresh Ganwar University is to provide world-class education in a wide spectrum of fields with effective and efficient process so as to make it accessible to all the section of the society that will best serve the nation and mankind of 21st century. The Suresh Ganwar University is established in 2008. Actually, the college is established through means 2003 by the government of Rajasthan. So Ganwar University was made in 2008 by the government of Rajasthan. So it is approved by the UGC, ASAT, PCI, Pharmacy Council of India, and regulatory bodies. So it is the first NB accredited institute of the Jaipur 2008 and is running various courses in the agriculture, engineering management, pharmacy, hotel management, education, and sciences, liberal studies, and mass communication. So NAC accredited, we are NAC accredited, first NAC accredited university in the Rajasthan. Then we have got sure career growth with the most awarded universities. So these are the so we have the special 20-point mission that will help you to grow overall your personality. So we have the alumni which are placed in the various good companies and industries and in the government sector like your drug inspectors, okay, and pharmacists. So we have continuous evaluation system. Then we have entrepreneurship cell. Then we have LMS that is unique in its nature that very few colleges have this facility. So it is learning management system in which you will get all the material which you will study in advance. So you will be provided one username and password. Okay. So we have collegiate system. So when you come across, then we will in your orientation program you will get to know about the collegiate system and all the things. Then we have mentoring program. So each student will get a mentor. So he can share his problem with his mentor, and the mentor will provide the solution for that. Then we have the placements. If very good companies come for the placement in the Rajasthan, we have the clubs. Okay. So and we have all this sports facility and your research and development and sports is there. Then we have various clubs like we have 13 clubs in which you can join. Uh, so it is good for your overall development. Then we have unique initiative like we provide you the industrial mentors, which will to help the student understand the formal and informal structure of the real life business operations and develop professional skills. Industrial mentors to guide and advise the student on their future career development, to facilitate the education, social and personal growth of mentees, to empower the mentees to face challenges in the your society. So here we have various industrial mentors from the different industries like Wipro, Kynap, Sun Pharma, okay, then Lupin. So all you will get the industrial mentors from the different fields. Then coming to the USP of the School of Pharmacy, we are among the one of the best institute catering pharmacy education, the diverse programs in 2003. As you know that we have recently got 64 position in the NRF ranking, right? So it is a very proud moment for all the pharmacy or SGVs. Then we have resources that the facilitate learning like highly qualified, experienced and research-oriented faculty, Then 20-point mission program, including your personal tutoring, lab-oriented projects, community clubs, industrial mentoring, training and placement. More than 350 national and international publication. We have 300 national and international paper presented and 200 abstract publication. Then we have 12 patents published, 9 patent filed, 1 industrial registration designed and registered. Our industry and academic partners include the National Research Development Corporation (NRDC), okay, Cyber Java, University College of Medical Science, Malaysia, Ayush Raj Enterprises Private Limited, then St. Paulo School of Healthcare Professional Philippines, then University of the Wolverhampton, UK. So we have the various MOUs. Then fully equipped laboratories, including the highly sophisticated instrument, including HPLC dissolution apparatus, UV visible spectrophotometer, so tablet punching machine and software-based molecular modeling. So we have a well-maintained medicinal plant garden, CPCA approved animal house facility, well-stocked library and online database of reputes such as Delat and Influvanet, then active industry linkage and compulsory training and attachment at the hospital, community pharmacists, and pharmaceutical companies provide a multifaceted views of the various roles of pharmacists play in the healthcare sector. Then active participation of the school in the various national level seminars and workshops on the recent advancement in pharmaceutical education and research throughout the year. So these are the various glimpses of the activities you are going to do also, right? Then we have the Jeepak Shodhshala. First area is your immunity booster, the enhancer, infectious disease, neurological disorders, nutraceuticals. The research is being conducted across the spectrum. We believe in exploring the multidisciplinary research in our department and help the student to excel in their field and develop the skill. Then we have research team like your Jivak Shodhsala. This is where we have research labs various. Then we have very dedicated faculties. Then Professor Dr. Ritin Kilota, she is co-president and dean Canvas School of Pharmacy. Then myself, Professor Dr. Santosh Kumar Singh, I'm working as the principal here. Then a few of the faculties are Dr. Abhay Rai Jada, he is the assistant professor, and Professor Dr. Hemant Kumar Yadav is a professor at Cambridge School of Pharmacy and HOD of B-Pharmacy. Then Dr. Gaurav Gupta, he is the associate professor at the Cambridge School of Pharmacy. Mr. Piyush Dave, he is a diploma. Then our laboratory outcomes, technology transfer to the National Research Development Corporation, Ministry of Science and Technologies in 2014, MOE with the National Research Development Corporation, NRDC, Industrial and Research Lab Association and collaboration. So Gandhia School of Pharmacy is listed in the resolution for the RTF BCS Research Training Fellowship for the developing countries scientists. Then we have various scholarships like your Acharya Purushottam Mukherjee Fellowship, Shri Suresh Sharma Memorial Scholarship, Shri Sunil Sharma Merit Scholarship, University President Scholarship, Dr. Sudhanshu Employee Welfare Scholarship, Srimati Kamala Devi Gender Equality Scholarship, then SGV Alumni Association Scholarship, then Jayaprakash Narayan Scholarship, so SGV Sports Scholarship. Right? So, in addition to these schemes, 50% of the tuition fee will be paid off for those students who lose their father while studying CBU. The Gamma School of Pharmacy, it is a overall teams-led, organized, and well fabricated modern classrooms. When we have accreditation and PCI approvals in NAC, PCI, and ASAT and NRF, then we go for the industrial trip in one semester. In-house communities, we have like 5 or 6 communities. We have in-house communities, and overall we have 13 clubs. Then cultural and technical fest we organize, and playground we have basketball, volleyball, football, and cricket, golf, and this various indoor sports are there. Then we have gymnasium, cafeteria, hostel facilities, AC and non-AC rooms, grand auditoriums, Acharya Purushottam Uttam and Kalindi we have both. Then we have well-equipped laboratories, industrial mentorship, LMS, as we have told you, the learning aids management system. This we will provide the online study material and training and placement in the top companies. Then university scholarship, person tutor programs, as I already told you. So these are the pictures. This is your pharmacy department. This is your hostel. So this is your library. This is a round building. So this is it. Very. Then university like your library is available. We have both the department library as well as your central library is there. Okay. So and these are the various photographs. And, this is all about your mainly these are the alumni. Like you can see that Rohit Nagar is a assistant drug controller in Kota. Ajay Kumar Sappal is also assistant drug controller. Gargesh is in Bokhar R&D. Amit Sharma is a senior perfusionist in the Manipal Hospital. So these are the various your successful alumni. And okay, so this is your glimpse about the pharmacy department. Then we are going to start the foundation course in which you will study about the entrepreneurship essential, then your development of the leadership skills, then your communication skills, soft skill development, stress management, stress and cholesterol. So you will this will be the lectures on these topics. It is important. The bridge course is important for your means bridging the gap between you and us. Right? So this is very much important, right? So our next lecture will be taken by the Dr. Priti Dubey ma'am, right? She will take your entrepreneurship essentials lecture today. Okay. So this is all from my side, and I'm logging out. And thank you and thank you very much, right? So next lecture will be Dr. Priti Dubey. Thank you.